Hello and welcome to lyranara.com, and today we're gonna talk a serious condition that affects a lot of men, especially as they get older, and it's difficult to treat with conventional medicine as well as to detect. So today we're gonna concentrate on not only the basics of prostate, of the cancer that develops in there, but how to detect it with conventional methods as well as always with a focus on alternative holistic methods, and then we're going to concentrate on how to treat it, especially holistically, non-invasively, and without any side effects. And so without further ado, let's get started and learn more about the prostate, what causes the cancer, and how you can detect and treat it holistically. And as I've mentioned in this video, we're going to present the real causes of prostate diseases with a highlight on prostate cancer. We will further describe you the different therapy modalities with clear recommendation for holistic, non-invasive and risk-free therapies. And as with all other health conditions, the triggers for prostate conditions are always linked to specific manifested psycho-emotional conflicts that are related to the procreation of descendants and mating. In Asian and African regions, people live more anchored to in their traditional family life, and men and women are facing less traumatic psycho events related to their tribe. And the incidence, therefore, of prostate cancer is significantly lower than in Western Europe and North America. And you can see here in the charts, you can just compare the US to Sweden, to China and to India. You're going to see that in China, India, Japan, etc., the incident happens much less frequently than in the US, Sweden, Canada, and all of these so-called developed Western countries. Often, prostate cancer is also a result of diagnosing methods such as PSA that we're going to talk about, which is not relevant enough for prostate cancer. You're going to see why. Prostate biopsy comes also with numerous side effects such as urination, endoejaculation with bleeding, local prostate injuries, spread of cancerous cells and other cancers due to the shocking cancer diagnosis. We're going to talk more in depth about this as well, of course, and we're going to present some of the best holistic and non-invasive methods for diagnosing and treating prostate disorders so you can really cure prostate cancer. You have, though, to apply the treatments concomitantly on psycho-emotional level, so you must resolve the biological conflict that we're going to talk about, as well as on a bioenergetic and physical level. And only in this way you can remove the root causes, avoiding cancer relapses, and you will restore the tissue to its full functionality so that your prostate can operate perfectly again. And to achieve this, you must permanently educate yourself and know your options, and that's why we're going to talk exactly about that in this presentation. But first, some general information on the whole biology of the prostate and the prostate gland. The prostate gland, as you can see also in the picture, is about the size of a walnut. It's located just below the bladder and it surrounds the urethra. The prostate is partly muscular and partly glandular. It has ducts that open into the prostatic portion of the urethra. And the prostate is made out of 3 lobes, a central lobe and 2 other lobes, one on the left and one on the right side. And the main function of the prostate gland is to secrete seminal during sexual arousal. A considerable portion of the semen is also produced in the seminal vesicle, and a sac-like pouch that opens into the ejaculatory duct that joins with the prostatic urethra. This is the seminal vesicle. One of the components of prostatic secretion is the so-called PSA, prostate-specific antigen, and PSA is also secreted by the female Skene's gland, the breast, the liver, etc. And it's not very specific for prostate inflammation or prostate cancer. The prostate gland also has embryologically some origin as the intestines, especially the cylinder epithelium, and the ontogenetically prostate developed from the endoderm, therefore it is controlled from your brainstem. So what are some of the specific biological conflicts that are related to your prostate gland? Well, consistent with the male's vital role in reproduction, the biological psycho-emotional conflict linked to the prostate diseases concerns the procreation, of course. And this function is very sensitive to emotional events in a male's life, such as that you are unable to father children, for instance, due to erectile dysfunction or infertility, or the female partner's infertility, vasectomy of the male could also lead to that. Male's descendants which didn't reproduce because of homosexual orientation or staying childless by choice or miscarriages or abortions. There is also a mating conflict. So if you're not able to mate or not allowed to mate, this translates into sexual rejection and you feel sexually unwanted. Mating conflicts are activated through the loss of a sexual mate or through sexual rivalry, such as the fight over a female, and a man's fear that his sexual mate is attracted to another man could already trigger the conflict, especially when a competitor is younger or has more potential. Gender conflict also comes into play, which can be experienced as an ugly conflict with a female. So, for example, being dominated, controlled, or humiliated by a woman. An imperious wife or mother could cause this, or degraded by a female authority, like a supervisor, a judge, a lawyer, doctor, police officer, and the like, and can go straight to a man's prostate. Also, a spiteful divorce, custody battles, emotional or financial abuse are other possible conflict scenarios. Let's dive a little deeper into the biological conflicts of the prostate ducts. So, two ejaculatory ducts deliver the sperm from the testicles and the fluids from the seminal vesicle, and they open into the urethra, and the walls of the prostatic and ejaculatory ducts are endowed with smooth muscle, equal to the intestinal muscles moving the food morsel. The prostate ducts' smooth muscles facilitate the flow of the semen morsel, and the lining of the prostatic and ejaculatory ducts consists of so-called squamous epithelium, which originates from the ectoderm and is therefore controlled from the cerebral cortex or the temporal lobe, which is different from the prostate gland, by the way. And those prostatic ducts, the ejaculatory ducts, the renal pelvis, the ureters, the bladder, and the urethra share all the same brain relays and therefore the same biological conflict. And the biological conflict linked to the prostatic ducts and the ejaculatory ducts is the same as for the urethra, namely the territorial making conflict. In this case, the marking conflict has a sexual nuance and a distinctive prostate procreation touch. A man can suffer this conflict when, for example, his ex-wife doesn't allow him to see his children, or when his space is invaded by a sexual rival or by a domineering female. Also, the ejaculatory ducts relate to an ejaculation conflict, as in not being able to being allowed or not wanting to ejaculate, which will manifest in a premature ejaculation. So you have to figure out which is your specific biological conflict, and like this you can identify the real cause of your prostate disorder, and afterwards you can start to work out solutions to this conflict. What are the disease phases of prostate cancer? Well, you start with one of the prostate psycho-emotional conflicts that we've discussed. And during the conflict active phase, the prostate gland cells proliferate proportionally to the intensity of the conflict. And the biological purpose of the additional cell growth is actually to increase the amount of semen in order to enhance the chance of impregnating a female. And once a sexual mate becomes available, of course. With prolonged conflict activity, a secretory cell augmentation, referred to as a benign prostate growth, develops, and if the rate of the cell division exceeds a certain limit, conventional medicine considers this to be a prostate malign tumor. If the prostate swelling presses on the urethra, the urine flow is also delayed and slow, with only small amounts of urine being expelled. And if the prostate growth is found in the lateral lobes of the prostate, it is usually diagnosed as a benign prostate hyperplasia, or BHP for short. The prostate ducts develop from the ectoderm, as we've mentioned already, and are controlled by the cortex, and thus the manifestation of the prostate duct disorders is different from the prostate gland. And doctors do not make this difference, unfortunately, but the ducts are losing cells, so ulceration of the ducts, causing symptoms of numbness and hypoesthesia. In the healing phase, a restoration of the duct tissue, cell replenishing, manifests with swelling, inflammation, bleeding, itching, pain, and supersensitivity. And these are actually all good signs of the healing process and would be recommended not to interfere here. Better to wait and celebrate the resolution of the conflict and of your prostate cancer, so to speak. Gonorrhea originating in a prostatic duct can also be diagnosed as prostatitis if the inflammation and the discharge symptoms are less severe, so do not use antibiotics to treat these disorders. Some of the symptoms that you have to pay attention to in order to detect prostate disorders: interrupted urination, urine with blood, and painful urination. Well, there are more benign reasons why a man's urine does not flow freely. It may come with bleeding, urination is painful, and may wake the man up many times during the night. In particular, in the course of the transition from the middle age to old age, the prostate gland often becomes enlarged. As in a man's psychology, being old means being sexually not performing well enough. All becomes a concern if it happens on a regular basis, and a variety of medical conditions can cause nocturia. First up is the urinary tract infection or bladder infection, infection or enlargement of the prostatic hyperplasia, a bladder prolapse, overactive bladder, tumors of the bladder, prostate or the pelvic area, diabetes, anxiety, kidney infection as well as kidney stones, edema or swelling of the lower legs, obstructive sleep apnea, as well as neurological disorders such as multiple sclerosis, Parkinson's, or spinal cord compression. But that's not all. There are other symptoms that you have to pay attention to. First, constipation and other intestinal issues. So in many cases, constipation results from a bad diet rather than prostate cancer. So the first step should be to consult with a dietitian and check your gastrointestinal system. And people who regularly suffer from constipation are more likely to develop prostate gland problems because this condition puts more pressure on your prostate. Also, pain in the lower back area, a deep and prolonged aching feeling in the area of the lower back that continues for a long time could be a warning sign. Also, people are much more likely to associate pain in the pelvis area with prostate cancer, but nobody should perform their own diagnosis. The lower back and pelvis pain is a result of the self-devaluation conflict mostly. Difficulty also getting an erection. There is a stigma surrounding erectile dysfunction, of course, that many men do not report, either as a standalone issue or as a symptom of something that is possibly underlying and yet undiscovered. Men who suffer from prostate cancer often report difficulties in getting and maintaining an erection, and this is a common condition and is usually the result of the self-devaluation conflict that weakens the prostate muscles, and this is a characteristic especially for elderly men. Painful ejaculation also is a symptom, and this symptom ties in with painful urination, as both the urination and the ejaculation share much of the same hardware, so the urethra, And many patients who have been diagnosed with prostate cancer report a painful sensation in the groin area when they are about to climax, and this is caused by the inflammation and enlargement of the prostate gland, which in turn can block and obstruct vital passageways. Experiencing pain when ejaculating does not automatically mean you have prostate cancer though. BPH or prostatitis can also be the causal factor behind a painful ejaculation, as well as a number of sexual transmitted diseases, so don't automatically assume that you have prostate cancer if you experience painful ejaculation. So now let's look at the methods that traditional medicine is using to diagnose prostate cancer and prostate disorders. So many urologists recommend following diagnosing methods for prostate cancer, which are PSA, biopsy, as well as a digital rectal exam. First up, prostate-specific antigen, or PSA, which is a protein produced by normal as well as malignant cells of the prostate. Also, female breast glands produce PSA, by the way. And the PSA test measures the level of this antigen in a man's blood, and the results are usually reported as nanograms of PSA per milliliter of blood. And the PSA can be elevated in men with prostate cancer, but it is not specific for prostate cancer. And the PSA test was originally approved by the FDA in '86 to monitor the progression of prostate cancer in men who had already been diagnosed with this disease through other methods, and even the FDA accepts that the PSA test is not characteristic only for prostate cancer. In 1994, the FDA approved the use of the PSA test in conjunction with a digital rectal exam to test men for prostate cancer. In addition to prostate cancer, a number of benign, so not cancerous conditions can cause a man's PSA to be elevated. And the most frequent benign prostate condition that cause an elevation in PSA are prostatitis, which is an inflammation of the prostate, as well as benign prostatic hyperplasia, which is an enlargement of the prostate. And there is no evidence whatsoever that prostatitis or BPH leads to prostate cancer. It rarely happens to have one or both of these conditions that lead to prostate cancer. And today there are two groups of doctors considering that a PSA of up to 8 or 10 may be specific for prostate cancer, while other doctors consider that a PSA above 2.5 is already a marker for prostate cancer. So temporary prostate inflammation manifesting in an elevated PSA can be caused by recent or excessive sexual activity, biking, and other intense sport activities. So you don't necessarily have to worry immediately if your PSA is high. The PSA test is no longer routinely recommended. In 2012, the US Preventive Service Task Force, USPSTF, officially recommended against that. PSA test often missed cancers that were there or found cancers that weren't there. PSA led to unnecessary biopsies, a dangerous, painful hit-or-miss procedure, and to unnecessary surgeries, chemo, or radiation therapies. Prostate cancer progresses very slowly, and men are more likely to die with it from other causes than from prostate cancer. Watching for significant changes in the PSA results once or twice per year is more reasonable if a patient is older than 50 and his PSA constantly moves up by 50% or more per year. It is still not biopsy time. Next, let's look at prostate biopsy. And prostate biopsy samples can be collected in different ways. First way is to pass a needle through the wall of the rectum, which is called transrectal biopsy, and is the most common way of performing a prostate biopsy. Also by inserting the needle through the area of the skin between the anus and the scrotum. A small cut is made in the area of the skin, the perineum, between the anus and the scrotum, and the biopsy needle is inserted through the cut and into the prostate to draw a sample of tissue. An MRI or CT scan is generally used to guide this procedure. At the 2013 American Society of Clinical Oncology annual meeting, there was presented a very provocative paper in which it was analyzed the 120-day mortality rates in men who participated in a PLCO, so the prostate, lung, colorectal and ovarian screening trial, and the results were truly disturbing. They observed that at 120 days the death rate was 1.3 per 1,000 biopsies done in men without cancer and was higher than 3.5% per 1,000 men in those who had cancer. And this is consistent with a previous analysis of the European randomized study of screening for prostate cancer, and the study resulted in the net conclusion that the biopsy harms outweighed its benefits. It's important to understand how this occurs. If someone dies prematurely from a biopsy at an average age of 62, he may have lost about 13 years from his life. On the other hand, for those men who are avoiding a cancer death as a result of screening, which we know is about 1 per 1,000 men screened in 12 years, they may gain only a few years of added life expectancy from the time they would have died of something else anyhow. So what are the risks of a biopsy? Well, the risks are first the bleeding at a biopsy site. So rectal bleeding is very common after a prostate biopsy. Also, blood in your semen. It's very common to notice red or rust coloring in your semen after a prostate biopsy. Blood in your semen may persist for a few weeks even after biopsy. Blood in your urine may occur. Difficulties urinating, so the prostate biopsy can cause difficulties after the procedure in urinating, and a temporary urinary catheter must be inserted therefore. Decreased ejaculation and erection difficulty or impotence may occur. Infections. Man may develop an infection of the urinary tract or prostate that requires treatment after the biopsy. The Associated Press reported on June 2nd, 2006 that more than 22,000 veterans who underwent prostate biopsies at the veteran hospitals across the country were being warned that improperly sterilized equipment may have exposed them to deadly viruses. Prostate biopsy is also a real injury which can accelerate inflammation of the prostate tissue, and any biopsy can contribute to a spreading of cancerous cells, especially due to a relapse of the psychological stressors and of the biological procreation conflict. So prostate biopsy is an invasive procedure with a very, very high risk for infections, urinary bleeding, as well as cancer relapse. And this is why we recommend that you don't use these invasive measures to diagnose prostate cancer. There are better alternatives out there, and let's talk about those. They are non-invasive and they are extremely reliable. And a correct diagnosis of prostate cancer must go over different tests. First, a blood test to determine deficiencies such as vitamins, minerals, amino acids, and here we recommend the great BioScan device for blood work. I'm going to post, of course, the link in the description box below as always. We also recommend that you perform a body toxicity analysis that is shown in the blood, the urine, the feces, as well as the saliva, which disturbs cell polarization and the energy flow. And here again, we recommend a BioScan device for doing that. Also, determine your body hormones, especially testosterone, estrogens, and other major hormones. Again, great device for that is the BioScan. Also, a psycho-emotional panel to identify the active psychological conflicts that we've already talked about, so the sabotage programs as well as the karmic influences. Also the prostate cancer gene 3, PCA3 test, which requires nothing more than a urine test that looks for active genes that are found only in prostate cancer cells. and most insurances will even cover this test. It's been available since 2004, but unfortunately few physicians use it. And we can trust the PCA3 test because in 95% of the diagnosed prostate cancer cases, the PCA3 gene is highly visible. Also, we recommend that you perform a power color Doppler ultrasound exam. It's non-invasive, it's painless, and takes about 30 minutes. It shows prostate tumors, even the tumor type, location, stage, and other abnormalities. If the test results are inconclusive or there's a typically slow-growing cancer, watchful waiting is our recommendation. So don't become hasty that you need to do something. Check it again and again over time and see how it develops. And now that you know how to diagnose it holistically, let's talk about holistic therapies. And first, I'm going to recommend to you the so-called prostate cancer PSMA radiation therapy. There's a new product called lutetium-177 PSMA, which was introduced for the treatment of metastatic prostate cancer. And Lu-177 PSMA therapy stands for lutetium prostate-specific membrane antigen radionuclide therapy, and the membrane antigen selectively binds with cancer cells. Lutetium radionuclides is thereby attached to the substance, which is a beta emitter, and after the introduction of a radiolucently labeled PSMA into your body, it binds only with the cells of the prostate gland, malignant neoplasm, and since beta radiation only extends a short distance, so only several millimeters actually, healthy tissues are not irradiated at all. And after the course of the PSMA therapy, cancer cells die and the tumor size is significantly reduced or fully disappears. The key point of this technique is that the drug kills not only primary tumor in the prostate gland but other tumors as well. Thanks to the selective binding, it also helps to considerably prolong a patient's life in general. This technique was developed in Germany and is used to diagnose and treat prostate cancer already. Diagnosis involves the use of so-called scintigraphy, which involves scanning the body and recording the beta radiation of the tumor formation region. PSMA, labeled with a radionuclide, is a compound that can lead to the development of an allergic reaction though, so therefore a test for hypersensitivity is mandatory before its intravenous administration during the main course of the therapy or during diagnostic scintigraphy. Predatory measures include visualizing the tumor, preparatory of course, which includes scintigraphy, computer magnetic resonance imaging, and ultrasound. These methods determine the size, the location of the malignant neoplasm and its metastasis. The radiopharmaceuticals used to perform PSMA therapy is excreted by the liver and kidneys, and therefore general clinical studies are carried out before its use, including a clinical analysis of the urine, the blood, and a biochemical blood test. Clinical studies help a doctor to assess the degree of possible risk associated with the influence of the radiopharmaceuticals on the liver and the kidneys. The duration of PSMA therapy may vary depending on the stage of the prostate cancer. The end of treatment is determined by the results of the control study, including scintigraphy with the labeled radionuclide PSMA. The average length of stay in a medical hospital is only 3 to 4 days though. And if you are interested in more information about PSMA theranostic, you can learn more about lutetium-177 theranostic diagnosis and therapy by following this link that I'm also going to post in the description box below, of course. And here, as a small appetizer, you see some nice graphics that explain the whole procedure to you. What about hormonal therapy? It is often recommended to men who are suffering from prostate cancer. So what do we know about that? Well, hormonal therapy is often used to treat prostate cancer, and unfortunately it is a chemical or surgical castration literally. It is a treatment that adds, blocks or removes hormones, but it makes things worse and never solves the prostate cancer. After we learned about the biological conflicts that are responsible for prostate cancer, it must be clear to all of us that this therapy is even more enhancing the original procreation conflict with the result of proliferating the tumor growth. Apart from the miserable life quality, the patient may be affected by other potential cancers related to the self-devaluation conflict or the life-threatening conflict. Hormonal therapy may be though recommended by doctors, but it is no realistic solution for your prostate issues. The procedure is recommended by conventional medicine to treat advanced or recurrent prostate cancer, to shrink a tumor before other treatments such as surgery or radiation therapy, to help radiation therapy work better, to control the cancer cells left behind after surgery or radiation therapy, and to reduce the risk that a cancer will come back, to relieve also pain or control the symptoms of advanced prostate cancer. And some patients may start hormonal therapy soon after they were diagnosed. Others may not start treatment until the symptoms of prostate cancer get worse. Some men may be on hormonal therapy longer than others. Some will start and stop hormonal therapy, while others will take it continuously for a long time. In any case, we don't recommend that you go this path. What about the so-called radiofrequency ablation therapy then? Well, radiofrequency ablation is used together with a new device called NCAGE, which is a tumor ablation with electrical currents. Ablation means destroying, eradicating completely. The electrical energy heats up the tumor and kills the cancer cells. You get a RFA through a probe that goes through your skin into your prostate tumor. For some men, radiotherapy or surgery to remove the prostate gland is not a suitable treatment, or they don't want to have the side effects that these treatments can cause. Another option is to treat only the area of the prostate that contains cancerous tissue. This is called focal radiofrequency ablation, and doctors will use an MRI scan to see which areas of cancer they think are likely to grow and cause problems, and they describe these areas of cancer as being clinically significant. Another new, relatively new prostate cancer treating method you might have heard about is called IRE or NANOKNIFE therapy. It's a new type of treatment for prostate cancer and is the irreversible electroporation, also known as NANOKNIFE. It's opening up new options for prostate cancer patients, and it shows low side effects so far. In NANOKNIFE prostate cancer therapy, strong electric fields are applied, causing cancerous cell death without exposing the healthy tissue to radiation or heat. The so-called irreversible electroporation, or IRE, reliably destroys tumor cells. Important is that anatomical structures in and around the prostate, such as the nerves, the intestinal wall, the sphincter, the veins, and the arteries, are spared. Erection and bladder control are thus well maintained. NANOKNIFE prostate cancer therapy has been certified by the FDA and the CE since 2006. And you can follow this link that I'm also going to post in the description box below to learn more about it. Another therapy method that you might have heard about is the so-called ECT therapy. It's based on the fact that it has long been recognized that galvanic currents, DC currents, not AC, can have a beneficial effect in the treatment of cancer. The latest ECT machines offer patients a safe and non-invasive alternative cancer treatment. ECT not only outperforms many of the conventional cancer treatments, but doesn't have any of the unpleasant side effects. ECT is highly effective for prostate cancer in its incipient stages. Especially, ECT therapy can resolve a prostate cancer tumor in as little as 3 treatment sessions. but it is not as powerful and sophisticated as the ECT G8 machine. However, very helpful for home use is the ECT therapy machine such as Veget Balance that you can also find at lyranara.com, and you're going to also find the description in the description box below the link to it. Bioenergetic therapy of prostate disorders, including prostate cancer, is very beneficial. So far, the psychological conflict was resolved prior to the bioenergetic treatment. The ECT therapy with the Veget Balance device combined with radio waves therapy with the Aquatone Advance or the Aquatone Professional that you also can get exclusively at Lyra Nara, and you're going to see, of course, again, the link in the description box below, does improve blood and lymphatic circulation in your prostate and has a significant prostate anti-inflammatory effect, and also helps detoxify the tissue around and in your prostate. And there exists also a great supplement that will help you a lot with your cancer problems and your prostate cancer, prostate problems in general. It's called PROSTAMISIN and it's based on DMSO. It's a natural herbaceous product that has been created specifically for prostatitis, BHP, as well as prostate cancer therapy. You can get it only at lyranara.me. Again, link in the description box below. PROSTAMISIN contains 50% ultra pure DMSO blended with different herbs. They are known for their beneficial therapy effects on the prostate gland and the prostate ducts. PROSTAMISIN can be taken orally, 1 teaspoon under the tongue 5 times per day for a period of minimum 30 days. It can be applied topically also in 2 different ways. You can rub it on the prostate area 5 to 7 times per day and massage it into the prostate gland with an ultrasound device. You can also inject it directly into the prostate only with medical assistance though. It's not recommended that you do this by yourself. Installation also through urethra catheters, but again, this method only with medical assistance. The therapy must be followed for minimum 3 weeks or more, depending on your prostate cancer stage. PROSTAMISIN comes also in the prostate herbaceous pack, which contains additional prostate permanent support to avoid cancer relapse, as well as psychological support to resolve your specific biological conflict. And this creates the necessary mental as well as emotional state to support prostate function. And with that, I would like to sum it up what we've learned about prostate cancer and wrap this presentation up. First up, prostate cancer is not a life-threatening condition if you understand the underlying psycho-emotional conflict which triggers prostate disorders, including prostate cancer. There is not a real cure of prostate cancer without first solving this biological conflict, followed by tissue repair using different procedures that we've mentioned in this video. Diagnosing methods such as PSA and prostate biopsy are not recommended as prostate cancer diagnose. You should instead use modern diagnosing methods such as the Doppler ultrasound or the PCA3 genetic test that we've also presented in this video. And if you believe in conventional therapy methods, you can choose those which do not impact your life quality, such as ECT, IRE, or RFA, and do not go ahead with chemo, radiation, hormonal castration. However, none of these procedures will be a final cure for prostate cancer as far as you have not resolved the underlying psycho-emotional conflict that is related to procreation, descendants, and mating. For prostate gland cancer symptom that appears during the biological conflict active phase, while for prostate ducts cancer, so ulceration, the symptoms are stronger and appear during the healing phase. Prostate cancer is also slowly developing cancer, and it may be more beneficial for you not to start running to hospitals and clinics to get treatments which may shorten your life expectancy and for sure will aggravate your psycho-emotional conflict and health condition. Better First, change your lifestyle, harmonize your relationship with your family and your partner, understand and accept the aging process. Do not panic and self-devaluate yourself, and you can heal only from your inside. Call us if you need help. As always, 1-888-773-3196. This is 1-888-773-3196, or contact us at shop@lyranara.com. We love to help you. I hope that you've enjoyed this presentation, and if you did, please like, share and subscribe, and until next time, stay healthy.